It has been 1 week since the launching of the National Prescription Drug Plan. Pharmacies throughout the Bahamas are now accepting the ACE-RX cards from citizens signed up for the plan. The walk-in pharmacy is a participant in the drug plan and gives us its 1-week report. Michelle Finlayson, walk-in pharmacy coordinator, gives us an overview on the pharmacy's activities in regards to the drug plan.
With the drug plan, it's in place now. All of our locations are fully stocked and ready to go. We've had lots and tons of phone-ins, and we're able to oblige the patient in knowing exactly where our locations are. Right now we're located Collins Avenue, Carmichael Road, major facility at Carmichael Road. The pharmacists are just waiting for the flood that we expect to come in, because the program is an awesome program, as well as Sandy Port. And of course we have 2 affiliate pharmacies that we are all working closely with. That is at Robin Hood. So if you're doing your shopping at Robin Hood, the discount pharmacy there as well, it's affiliated with us, as well as Patande Pharmacy on Saunders Beach. So the pharmacies are stocked and ready to go. The first week, like I said, we were just really answering a lot of questions. Patients were calling in, and it was basically, we found that it was the testing period. We had quite a number of patients just coming in, just wanting us to swipe to make sure they were in the system, that the medications were the correct medications. So it gave us a feel of what is expected or what we expect in the months coming up. So we're very excited.
Well, the first week of the prescription drug plan with the walk-in medical clinic went very well. The first week we had a lot of calls with patients trying to find out where they're situated in terms of location, because they want to know where they can come at the end of the month to get their medications filled. The second week we had 1 or 2 prescriptions that came in. They're coming in slowly because people are just renewing at the end of every month. We had 1 or 2 glitches within the national insurance system, but everything went smoothly. Once we called the NIB, they were able to iron out everything, and everything went perfect. We have all the drugs in that they need, so nobody was turned away. Everybody got served, and everything was done in a timely manner. Like any new plan, you'll have 1 or 2 glitches in the system, but once everything is ironed out, I think the plan will go by very smoothly.
Well, the first week at the walk-in Sandy Port went very well. We have our dispensary fully stocked with all of the medications, and the computer system is running very smoothly. I had 2 patients so far and many calls, and so we have the western area of New Providence excited about coming to collect their medication. And we have quite a few patients out there that are elderly and really happy about this program. So I'm looking forward to having quite a few patients this weekend with the coming weeks with NIB.
On the flip side, Rochelle Bastian, a friendly pharmacy, gives us an idea of what challenges she met.
For the most part, it's running okay. We're finding that our biggest challenges are the education of the clients. A lot of people seem not to quite understand what needs to happen in order for them to get full coverage. They need to understand that they need to register the various disease states in order to be covered for the drugs under that disease state. And from the technical side of it, actually, it seems that the program is running well. We seem like everything else is going well. The receipts are printing properly. We've gotten some denials. We've gotten some approvals. When we do get denials, we have used the callback, where we call an emergency number and someone answered promptly, and they were able to explain to us so that we could inform the client. For me, I actually haven't seen an increase in numbers. What I am seeing is patients who were previously paying by private insurance or who were paying by cash are now switching over to the NIB plan. The increase in numbers, I haven't seen that as yet.
For more information on collecting ACE-RX cards or registering for the drug plan, call NIB hotline at 888-356-2032 or 242-300-0001 if you're calling from Grand Bahama or the Family Islands. And for more information on participating pharmacies, log on to www.nibdrugplan.com.